Good afternoon. I'm Kathy Sacco, Vice President of International Children's Policy at First Focus on Children. Welcome to our panel on the global and secondary impacts of the COVID-19 pandemic on children and youth. This panel is one in a series of webinars First Focus has hosted to shine a light on how the COVID-19 pandemic has devastated children's lives, and to discuss how we can move forward to make sure all children have the opportunity to succeed and thrive. Before we get started, let me provide some housekeeping notes. Today's panel is a webinar, so everyone is muted. But if you registered, you have access to the chat function, so please feel free to put in your questions throughout the panel. For those streaming this live, you can submit questions on Twitter using the hashtag #KidsAndCovid. We hope to be able to address your questions at the end of the presentation. And the webinar recording will also be available online following today's event. So with that, I am honored to introduce our esteemed speakers for today's panel. First, we have Dr. Susan Hillis. Susan has served as a Senior Technical Advisor on the CDC COVID-19 International Task Force and as Senior Technical Advisor for the Faith and Community Initiative for the U.S. Global AIDS Coordinator. Her research, spanning domestic and global regions, has led to authoring over 130 peer-reviewed publications addressing COVID-19 associated death of parents and caregivers, HIV, violence against children and youth, adverse childhood experiences, sexually transmitted infections, and orphans and vulnerable children. Next, we have Philip Goldman. Philip is the founder and president of Maestro International, a team of leading global experts supporting the development, strengthening, and coordination of child protection and social welfare systems that meet the needs of children in adversity. Then we have Jennifer Rigg. Jennifer is the executive director of the Global Campaign for Education US, a coalition of over 80 organizations that promotes access to quality education as a human right and mobilizes the public to create political will in the US and internationally to ensure universal access to quality education worldwide. And finally, we have Christy Hart. Christy is the Director of Policy and Advocacy at Together for Girls, a partnership of 20 national governments, civil society organizations, UN entities, development partners, and the private sector to promote evidence-based solutions and galvanize multi-sectoral action to end violence against children, with a special focus on preventing sexual violence against girls. So I just want to thank all of our panelists for being with us today. So to get I want to get our conversation started to just give all of you enough time to answer questions and to share your insights and wisdom. So as our webinar series has shown, the pandemic has affected children's lives in so many areas: education, healthcare, mental health, safety. And obviously, we've seen the impacts in our own lives, maybe on our own children, and know that the pandemic doesn't care about borders, doesn't care what country you're from, your age, your gender. So, to give us a starting point, I wanted to turn it over to Dr. Susan Hillis to tell us more about the study that looked at how the COVID-19 pandemic has left millions more children without family caregivers and the implications this has for children globally, including here in the US. So Susan, can you tell us more about the study that was originally published in The Lancet last year and updated numbers?
Sure. Thanks so much, Kathy. I'm glad to. And Philip Goldman and I will be sharing this presentation. So I'll go halfway through and then we'll switch over to him. So I want to talk with you a little bit today about the global COVID-19 orphanhood crisis, overcoming extreme threats to children. Next slide, please. There are three big takeaways. One is over 7.1 million children have lost a parent or caregiver to COVID-19 as of about 2 weeks ago, April 4th, 2022. COVID-related orphanhood has been doubling every 6 months until about the 2-year mark. It's slowed down now. And new evidence is available to guide urgently needed national responses to these global surges in COVID orphanhood. Next, please. We have three categories of children that we are considering in our data. One is the first there, the one blue box, children that have lost a parent, either one or both parents, mother and father. The middle category, children who have lost a parent or a skipped generation grandparent responsible for all their needs in the absence of parents. And the third category is the category of children who have lost either a parent or a primary or secondary grandparent caregiver. The secondary caregiver lives in the home and assists with their care. But you see nearly 5 million orphans, 5.1 million children have lost a primary caregiver, and over 7 million children have lost a primary or secondary caregiver. Next slide, please. It has been quite striking and disturbing to us that while it took 10 years for 5 million children to become orphaned due to HIV/AIDS, it's only taken 2 years for nearly that same number, 5 million children, to become orphaned of a parent, one or both parents, due to COVID. Next slide, please. One of the things that's really important for us in this talk is that you recognize that every one of the numbers we're talking about involves the fates of a child. This little girl, Deanna, was being cared for by her mother after her parents had died. And she poured boiling water on herself, accidentally trying to pour her morning tea after her grandmother had dropped dead at home due to COVID. And the neighbors, the pastor and his wife, heard and ran in and helped take her to the hospital. But we want to remember that these are real stories of real children and all the data we're describing. Next, please. Here, if you can just click that start button on the left, I want you to see in just 12 seconds how rapidly the COVID pandemic has overtaken the world. So I don't know, the little two left boxes, if you can click them so that it turns from stop to start. Can whoever's running the slides do that, please? Okay, so it appears that that was not working. Well, you'll have it in the slides, and you can see that you're going to go up to quickly a bright red world. That's just shocking with the world being on fire. Next, please. Here you see that in the around the last 6 months of 2021, in purple, you see the number of COVID-related deaths reported. And in light blue, you see the number of children orphaned by COVID. And what I really want to point out is that we have now more children orphaned by COVID, orphaned or having lost their grandparent caregivers, than we have people who have died of COVID. And yet relatively little investment has really been directed towards them. We also see in the right-hand side, the last 6 months roughly of 2021, the number of children orphaned by COVID doubled compared to the first 14 months. Next slide, please. Here we see in purple the 32 countries that are high burden countries for COVID-associated orphanhood and caregiver death, where more than 25,000 children have lost their caregivers in just the first 2 months of the pandemic. 18 of these happen to be in Africa, with most of the 18 having robust PEPFAR, orphans and vulnerable children programs. Next, please. We also were disturbed to learn that 3 out of every 4 COVID orphans worldwide have lost their fathers, and therefore at increased risk of exploitation, abuse, poverty, and vulnerability to violent extremism. Next, please. I'll close with this little before I turn it over to Philip with the end of the story for this little girl. The pastor was able to find Deanna's great aunt, a widow living in a nearby village, who did agree to adopt her, but she doesn't really have enough money for food, vegetables, juice, and fruits, and cannot really afford transport to get Deanna back to the clinic to see that her wounds are well healed. Again, demonstrating that there are many unmet needs for these children. Next, please. Turning over to you, Philip.
Thank you, Susan. And you know, the scope and scale of this just can't be underestimated. You see the names of the organizations that were involved in producing this research. We poured a lot of time and effort into this. There were quite a few brilliant minds working just on the data and the numbers. And it became very quickly evident to us what Susan has just pointed out, the pace, the scale, the rapidity of the spread, which was so much in excess of what we saw in the early days of HIV. And I started to think the theme of this session is appropriately on secondary impacts of COVID-19. And we think of primary impacts as being essentially those who have died from the disease. That's the primary impact. And I guess that makes some sense. But if you're a child who has lost a parent to the disease, it feels pretty primary, especially because unlike many other chronic diseases, including HIV, COVID-19 kills quickly. It could be a matter of days or weeks between the onset of the disease of a caregiver or parent and then the actual death. And so there's very, very little time to prepare. It's an absolute rapid shock to the household. And that element, I think, is sometimes underestimated when we look at the numbers. We can see these graphs, which I think are very telling in terms of the exponential increases. But somehow to just understand how much of a shock this is to the child and family, I think is important, again, in understanding why this is an issue of great magnitude to us. Now, next, please. We wanted to emphasize that we have decades of experience through PEPFAR, USAID, World Bank, and other programming that can actually inform the way forward in addressing the secondary impacts of the pandemic. We tried to look at this holistically and break this down into 3 areas that we think all are essential for the response. Any one of them just would not be enough to really target the issues that Susan has begun to address, and I'll go on with some others. They're the 3 Ps, so we try to make it easy that way. Prevent, prepare, and protect, and I will go through each of the Ps in turn. Next, please. So starting with prevention. It's obvious that we're not going to stop orphanhood or caregiver loss until we stop death from disease. And so that brings us full circle to equitable vaccine distribution. Our research team strongly endorses anything that can be done to increase the spread of vaccine, the utilization and acceptance of the vaccine in order to reduce the rise in orphanhood and caregiver death. And that includes other public health measures that are necessary to spread the disease and to keep people healthy, and responding with the availability and access to good clinical care so that those who do come down with the disease can get treatment that hopefully keeps them alive and well. As you can see in the Africa region, we're only at 20% of the population that have been vaccinated. And while there has been somewhat of a downturn in the disease here in the States, there's been an uptick in many other areas of the world. This disease, this pandemic, is coming in surges. So we're not feeling very much confidence in some of the downturn in the numbers. We're quite concerned over the long term that the numbers will continue to go up. And on that, once a child is orphaned or has lost a caregiver, that's forever. We can't turn that around and mitigate it. Those numbers just keep going up and up. Next, please. Prepare. Well, science tells us that a child thrives and is much better supported in a safe and nurturing family. And in past epidemics and emergencies, there's been an emphasis on building up and creating orphanages and children's homes and residential options for children, 80, 90% of whom or more have a living parent or an adult who is in the family able to care for them. And so because of the negative impacts of institutionalization and residential care on children, we are pushing for this pandemic to be different from how the world has responded in the past. We can serve 6 to 10 children in family-based care for everyone that's placed in an orphanage or a children's home. So we'd like resources to be directed just towards that. And it's not just a matter of serving more children. It's helping them to have outcomes that are much better. Social development, linguistic, cognitive, physical development, across the board, we know that families are a better place for children to be. It's where they absolutely need to be. Next, please. And then there is a slew of research that we reviewed as part of our work together, but that many others have contributed to, including some on this call. And that research pertains to the risks that children who fall outside of family care or who lose care can experience with respect to violence and abuse and neglect. And that violence in turn, and there's so much evidence on the loss of parent or caregiver related to increased risks of violence in and outside of the home, that in turn leads to a whole nother slew of issues with respect to higher risk for disease, disability, and premature death, inability to attend school or to perform well in school, higher likelihood of engaging in high-risk behaviors, mental health problems, including from the loss itself. Let's not forget grief here and how grief in childhood from the loss of a parent or a loved one can persist throughout life. And we have a lot of science and evidence on that as well. So we highlight this slide because we want to show that this issue of loss is connected to other efforts that are underway to mitigate and reduce the risk of and perpetration of violence against children. Next. And we look to integrated programming for doing that, evidence-based programming that have been developed after long thought through the INSPIRE package that combine the importance of addressing economic stressors through parenting support, economic strengthening of the household, trying to do everything we can to make sure that the childhood is able to support itself and access good nutrition. The importance of access to education, we'll be hearing more about that shortly, just after this presentation, is critical. And then the importance of valuing children and helping parents to both not only value their children over the longer term, but to care for them and to nurture them. And we found that many of these measures, that the numbers in the bubbles are the Sustainable Development Goals that we think relate to this agenda. But as importantly, we believe that the evidence shows that these kinds of programs that are often delivered by and supported by a strong social service workforce, social workers, paraprofessionals, psychologists, and the like that are trained, even volunteers can be trained in support and mitigation. We believe that that underpinned by this, we'll see reductions in abuse, in violence, and high-risk sexual behaviors, improvements in school attendance, and certainly in health status. Next. So recently, a team has prepared some very helpful parenting resources. These are concise, brief materials that are social media friendly. They are very much evidence-based. There was a huge consultation that went into this. Of course, they are produced quickly, but with quite a bit of thought. And they've been translated to over 100 languages and have been disseminated through an amazing network of NGOs, multilaterals like UNICEF, WHO, faith-based organizations, and you name it. Next. And so this is just showing you a bit of the content of the materials on kids and COVID, some basic messages on managing stress, which are so important, and some impressive statistics on the best we can tell from our colleagues who monitor social media and the like, just how quickly these have reached over 200 countries and have at least been clicked on by 144.7 million people. And if you need access to those, we'll make sure you have access to those after this presentation. Next. I wanted to get near to close here by highlighting that we did do a costing. What would be the resources that would be necessary to address an agenda, to advance an agenda that would mitigate these secondary impacts of COVID-19? We developed a reasonably sophisticated model with a lot of flexibility in it. We focused that model on countries where US government programming through USAID, CDC, and PEPFAR is operational. We did that for a number of reasons, including the fact that we wanted to highlight what the ask might be of the US government for a global response over 5 years. The model assumed 9.4 million children would be reached at a targeting efficiency of 65%, meaning we would reach roughly 65% of those in need. We would love to reach 100%, but we didn't think that was a realistic assumption. And we highlighted the costs to different actors beyond the US government, particularly the World Bank, the governments where we're seeing the issues arising, and so forth. We developed a holistic strategy to strengthen the capacity of national systems, to strengthen multilateral partnerships so that we would see UNICEF and World Bank and others engaged on an agenda that would support the 3 Ps, and to scale up programs and services in the countries. And as you can see, we reached a total cost in fiscal year 23 of about $3.1 billion, of which governments in the World Bank would shoulder the vast majority of that, maybe $2.1 billion. We do see an ask that we've been beginning to present of a little over $300 million through US government funding, and then hope for funding from other donors that are out there as well. It seems like a lot of money, particularly to those of us working in child protection, but in PEPFAR, that was launched as a $49 billion initiative with $15 billion in the first years. And we're seeing, as we've stated, some really scary numbers here with orphanhood and caregiver loss. So we think in terms of the need that we've outlined here, this is a very reasonable number. I'm sure some of you are asking, why is Ukraine underneath in red, 173 million? Susan and I described this as the perfect storm for those of us working in child protection. The perfect storm was 3 fronts that came together in the early 1990s off the New England coast that created 100-foot-high waves, a famous movie many of you have probably seen, a famous storm. Well, the first front for us is where children were at before the pandemic, the billion children who were exposed to violence prior to this, the many other protection violations that we were trying to address. The second front is COVID-19 and what Susan presented in terms of the numbers. And the third front, we believe, coming together is Ukraine. We have a situation where 1.5 million children have crossed the border, leaving behind their fathers. If their fathers, they've lost care automatically. Another 3 million or so remaining in the country and displaced. That's in aggregate 2 out of 3 children. And it's just an enormous loss of care, untold numbers of unaccompanied and separated children and like. That's going to require a multi-year response. And so we focused on potential for US government engagement on that agenda, drawing on our experiences with PEPFAR, with USAID, with our Children in Adversity program, and came up with a number of about $173 million in fiscal year 23. Noting that Europe is also putting money into EU countries to support the needs of the children. Next. So just to close here, we encourage you to follow our work. We have and can provide access to a widget, which in more or less real time, it's updated every week or 2, will tell you by country and globally how the numbers of caregivers that are being lost is increasing. So you can use that in your advocacy and research, your policies, and your programming. I'd like to thank you very much for your attention. We'll look forward to your questions. But I believe now I'm to turn it over to Jennifer, who's going to talk about how COVID-19 has affected education for children around the world and what the future of those children might be. So thank you, Jennifer.
Thank you so much. It's a joy and a pleasure to join all of you today, and grateful to all of you for taking action, caring about children, and this opportunity to come together to turn around not only what's happening due to the COVID pandemic, but to make sure that together we're really building more inclusive opportunities and truly building back better. So in terms of education and the status for kids globally around the world before the pandemic, approximately 258 million children were out of school. We know that over these past few years, the COVID-19 pandemic has brought on a global learning crisis, resulting in 1.6 billion out of school children at the height of school closures, meaning that over 91% of the world's children and youth have been impacted. Like was mentioned earlier, many of us see this in our own day-to-day activities with our children or those in your community. But for young people around the world, they might not have access to computer online learning. The digital divide is very real. And to break that down a little bit to help give a picture, for example, it's estimated that 20 million more girls around the world may never return to school unless we act today. And for kids who are especially impacted, 9 out of 10 children with disabilities in developing countries are currently excluded from any form of formal education, and the majority of them are girls. We've been talking a little bit about the impact of COVID and emergency settings. So well over 40%, 48% of all school-aged children in refugee settings are currently out of school. So we know that for the kids that are so direly impacted, we must act. And I'm looking forward to the conversation as we delve deeper to talk about how we can act together. And specifically the linkages, school is such a protective force. So inclusive education to really reach all young people is critical. And as we think about violence against children before and after the pandemic and now, I believe we're next going to hear from Chrissy to talk about the area that she works in with violence against children before and now with the pandemic. Thank you.
Thanks so much, Jennifer. And a big thanks to Kathy and the First Focus team for convening this conversation series and for all of you for being in attendance. Certainly understanding what issues children and adolescents face prior to the COVID-19 pandemic is such a critical place to start because it gives us a baseline to understand the already significant vulnerabilities that children were facing and what's changed in the pandemic context. So as Kathy mentioned, Together for Girls is a global partnership. We're comprised of the US and Canada, 24 additional national governments, 7 UN entities, including UNICEF and the World Health Organization, and private sector partners. Our model is threefold. We focus on data and evidence to inform advocacy that drives action to prevent and respond to violence against children, adolescents, and youth. And in doing this, we pay particular attention to the gendered impacts of violence and specifically the experiences of adolescent girls and the issue of sexual violence. So for us, data guides the way. We support the implementation and use of violence against children and youth surveys. We call them VACs. They are demographic household surveys of 13 to 24-year-olds that measure the prevalence, nature, and consequences of physical, sexual, and emotional violence against children, in addition to drivers and risk factors associated with violence. So the VAC surveys are implemented by national governments with technical support from the US Centers for Disease Control and Prevention, and they constitute really the most comprehensive nationally representative sources of data on violence against children globally. We currently have data that captures the experiences of over 10% of the world's children. So what the VACs and other data sources tell us about violence against children prior to the pandemic is this. Violence against children is itself a global pandemic in its own right. And just by way of a quick example, VAC's findings from across 22 countries reveal that as many as 21% of boys and 38% of girls experience sexual violence. So more than 1 in 3 girls in some countries. VAC's findings reveal that perpetrators are commonly known to the victim, including parents, neighbors, teachers, peers, and other community members. And you can imagine what this means for a sequestered, pandemic lockdown context. And finally, the VACs give us context for understanding drivers and consequences of violence against children, including gender norms and attitudes, and the consequences of experiencing violence from physical injury to mental health consequences, unintended pregnancy, school absenteeism, and then whether children are disclosing their experiences of violence and seeking and receiving services. So these data are instrumental in helping to improve prevention and response policies and programs to focus on areas of greatest need and also greatest potential effect. And in terms of the pandemic, it really put a hold on the opportunity to implement the VAX surveys, but it also allowed for the development of a COVID-specific module that is currently being implemented or will soon be implemented in Ethiopia, Eswatini, and Jamaica, and as new VAX are undertaken. So this will give us some specific insights into how lockdowns, school closures, economic stress at the household level, and other pandemic-related factors have influenced children's vulnerability to and experiences of violence. So there will be enormous value in both understanding these data and observing how governments are applying them to the development of responsive national policies and interventions. I'll stop there and hand it back to you, Kathy.
Great. Thanks so much, Christy. You know, the numbers and statistics and things is just staggering and sobering. And I think so I appreciate the study and looking at data and things that all of you are doing. So just going in, 2 years into this pandemic, we now have vaccines, and I know before Susan and Philip had kind of talked about who was getting vaccinated and how many vaccines were getting distributed across the world. And most recently, vaccines were approved for 5 to 11-year-olds, and hopefully vaccines for children under 5 are coming soon. And on April 5th, the White House actually announced that the U.S. will be the first nation to donate millions of pediatric COVID-19 vaccines to low and middle income countries. So, Susan, I wanted to ask you, can you speak about the challenges in vaccine access equity around the globe, and what those barriers are to vaccine access for children in other countries? Okay, it looks like Susan's not on. Maybe Philip, could you touch on that?
Sure. Barriers to access for vaccines, there are multiple and very complex. I think one issue, of course, has been just getting the supply, getting those issues sorted out so that there is enough for the world to utilize. And then there's the supply chain. It's not the easiest vaccine always to deliver to remote communities. So getting it out in that sense has been somewhat challenging. There's been a lot of discussion about trying to open up the technology for vaccine production to the countries where we're seeing the spread in low resource settings around the world, say in sub-Saharan Africa. Those obstacles still remain, but the hope is that these vaccines are not just produced in the global north, but that we can equitably produce them more broadly. And then there's vaccine resistance. It's huge. There is a big agenda here for changing attitudes towards vaccination so that when it does become available, people do actually take the immunization, and that's critical. These and other measures are just absolutely crucial for us to check the spread and to try to reduce the chance of new variants.
Thanks, Philip. Do you have any insights into this recent announcement from the White House in sharing pediatric COVID-19 vaccines? I guess I was interested because I've been following, the Gavi Alliance and the State Department saying how many, free vaccines that they've shipped out to different countries. But I was wondering if they were, if there's going to be looking at tracking how many children's doses are being distributed or who's receiving them.
I'll be honest, I haven't been working so directly on that, but I think to the extent that we can get shots in arms to populations in risk, we have to do that. Obviously, the higher risks are certain demographics, older people. We're also finding a great disparity in mortality amongst minorities and lower income, you name it. So in an ideal world, we would be able to target effectively the higher risk groups and get the vaccines in those arms first. But I think that's proven challenging, and the resistance, the hesitancy has been one of the biggest challenges. Even as we're starting to gear up on supply chain, we really need people to accept the fact that this will help keep them well, and that's just not always the case.
Great. Thanks, Philip. Um, across so many issues that we've kind of talked about, education, healthcare access, mental health, violence against children, the pandemic has further exposed the disparities along racial and economic lines around the globe. What I would like to ask our panelists is what government policies and programs are needed to ensure children impacted by COVID can survive and thrive? And I would also share, I know, that Philip was talking about the PEPFAR model and potentially what kind of funding. So I would just be interested to hear from our panelists, on any other ideas or insights you might have. So I'll start with Jennifer.
Thank you so much. It's such a great question, and it's really critical, absolutely, not just in the midst of the COVID pandemic, but beyond, to fully address those disparities and ensure youth voice. So, as we're thinking about government policies and programs to ensure children impacted by COVID can survive and thrive, it's vital to fully fund and prioritize children, youth, education, and all of the top interlinked topics discussed today in government policies and programs. So, for example, addressing school related gender based violence, making sure that there's strong water, sanitation, and hygiene support in schools and across communities. As we think about young women and why, reasons for why they're dropping out of school or might not come back to school in the midst of the pandemic, it's important to ensure menstrual hygiene management and support to break stigma about young people being in school and continuing. And then safety at school, not just during the school setting, but on the way to and from school is really vital. We've talked about caregivers. Let's make sure we're fully supporting teachers and really empowering teachers as well as young people themselves to help shape these policies. And then identifying and engaging out of school children is vital. So making sure that there's really strong parental and community outreach so that young people who are most impacted can be reached immediately and fully supported. Thank you.
Great. Thanks, Jennifer. Christy, do you?
Yeah, thanks, Kathy. I so appreciate your responses, Jennifer. And I'm going to talk a little bit more about process. And this, of course, is my bias. But I think, in terms of this question, this is another area where there's so much power in data. I'm going to talk again about the violence against children and youth surveys, but I think a lot of these lessons can be sort of extrapolated to other data sources, the powerful data that Philip and Susan have shared. And again, other sources. So when a country implements a violence against children and youth survey, there's a head of household survey that's conducted along with the primary survey of children, 13 to 24, that captures the socioeconomic demographic details, including things like household income, the level of education of the head of household, access to piped water, and food security. And certainly, these are data we can get from lots of other sources beyond the VACs. But what happens in capturing, these data, this allows us to understand where there may be significant disparities and vulnerability driven by these socioeconomic factors. And the results certainly vary. So some countries demonstrate a strong correlation between, for instance, economic insecurity and children's risks of violence, and others where vulnerability to violence doesn't seem to correlate as strongly to socioeconomic status. So having data that's this specific allows a country to prioritize where to invest limited resources. With the VACs, we engage in a process called data to action, which brings together a multi-sector group of public and private sector stakeholders that have some mandate that lands on child protection and response to violence against children. So it could be a Ministry of Finance, Ministry of Gender and Social Development, Ministry of Health, what have you. And these workshops provide the opportunity to review the findings from the surveys, map them against a global framework of sort of best practices and categories of interventions, be it education or addressing social norms, and then taking stock of what existing policies and programs exist to identify where policy changes and programmatic investments have the greatest effect. So for example, if findings from a survey reveal a strong relationship between the level of educational attainment and the risk of experiencing violence, or high rates of violence in and around schools, then school-focused interventions could be identified as a high priority. And I'll just briefly note in closing that the VACs are actually going to be implemented in the US for the first time with a pilot plan for the city of Baltimore. And personally, I'm so excited about this opportunity to utilize this survey for the first time domestically to understand the nature of violence against children and youth in a national context where we already have so much data demonstrating inequities driven by race and economic status, but little data linking those inequities to violence experienced by children. So I think this is going to be a great learning opportunity to see how the city of Baltimore puts those findings to use, particularly in light of the findings that will reveal some of the impacts of COVID-19 on children in the city.
Oh, thanks so much, Chrissy. And I just say on a side note, I live in Baltimore City, and so I was super excited to hear about like this vax, that Baltimore was selected because it's a great city, but we have our challenges, and I think the more information and data that we have, so we can better address the challenges for the children here. So I was very excited to hear about that. Okay, so next question. What would it take for the federal government and our community to better address the multifaceted needs of children? I know that there's been some discussion about it, but I thought to see our panelists and see what they have to say. So how about if I start with you, Chrissy, this time?
Sure. Thanks, Kathy. And this is such a great question. So at Together for Girls, we take a survivor-centered approach to violence prevention and response, and certainly we believe deeply in the power of partnership. We also recognize that decision makers and even those working to address violence against children have in many ways neglected the most important voices in the conversation, and that's those of survivors. So with that in mind, we've worked with adult survivors of childhood sexual violence specifically, and allied organizations to establish survivor-led movements, both in the US and globally. And these are organized around three key goals. So violence prevention, healing for survivors, and access to justice. In the US, we have the Keep Kids Safe Coalition, which has launched a national blueprint providing a comprehensive roadmap to scale evidence-based efforts to prevent and respond to sexual violence against children. And we're focusing on sexual violence because we recognize this as a stigmatized form of violence that is increasingly in the headlines and a critical entry point to addressing all forms of violence against children. So in this effort, through the Keep Kids Safe Coalition, we're working with leading national child protection organizations to really push the Biden administration and Congress to recognize the silent pandemic of violence against children that existed before the pandemic that's been significantly exacerbated by it, as well as gender-based violence broadly, and to commit to taking bold, ambitious action through executive action and through comprehensive legislation. And I think we'll follow up with some resources. I can share some links to that. And then additionally, we're doing something at the global level, very similar in nature, working with a group of 15 adult survivors of childhood sexual violence and allied organizations. We're called the Brave Movement, and we will soon launch a Survivors Global Call to Action. And the movement is really focused on mobilizing around three areas, including elevating survivor voices, raising billions to end VAC. As we saw from Philip's numbers, we need significant investments to address the multitude of issues facing children in the wake of the pandemic. We're also focused on ending the statute of limitations for survivors and ensuring child-friendly end-to-end encryption. And again, I'll follow up with some links and opportunities for further engagement. And yeah, I think to say, we really believe that putting survivors at the center of these conversations at every level, local, national, and global, can dramatically shift political will. As Susan said before, these aren't just numbers, they're real people. These are adult survivors and children. And we believe these efforts can really change the game in terms of the quality of prevention and response efforts. Thanks, Kathy.
Yeah, thanks, Chrissy. Philip, I know you had kind of mentioned some things in your presentation, but do you have other ways or what would it take, for the federal government community?
I'd like to follow up on something Jennifer said, even though I'm the child protection guy here. The World Bank estimated that the cost in present earnings to the current generation of students globally is $17 trillion in present value. $17 trillion, that's education alone. So the cost of inaction, just on the education agenda, let alone the huge impacts of the other protection issues that we've raised today is enormous. And if we're a country that really cares about poverty alleviation, social cohesion, economic growth, the future of nations, then these are agenda items that have to be at the fore. One ask that we have is there's an upcoming global summit, White House Global Summit here in the United States on COVID-19. The current agenda focuses very narrowly on health and has not focused on including the issues that we're discussing today. And so we do have an ask. We would like the United States and its partners around the world to put these issues and questions on the agenda, to understand their importance, their vital importance. Of course, as we've noted, we accept and embrace the need for vaccine distribution, but we can walk and chew gum at the same time in this area, and we have to. We absolutely have to, because the data points the way. As Chrissy said, the numbers point the way. Otherwise, the setbacks, I think, will be just too great, short term and long term. Now, within the specific approaches, the one that I started to mention, but I'd just like to highlight a little more. It's a little intimidating when I show that slide with all the bubbles connected, because it's so much, and how can we possibly deal with that? And that's why we do come back to social work as an area that we can really scale up, and where there's been a lot of attention through USAID programming in the last years. So, in any given community around the world, let's say a very poor and marginalized community facing a lot of stressors, we still know that the needs for each child are unique. In one household, the child may not be attending school for some reason. Next door, it could be an issue with disability. And the one after that, it could be a huge poverty and nutrition issue, and we can go on. And so what social workers do, or what we call the social service workforce, is they are trained to come into a household that's vulnerable, to assess the needs of the child and family, to come up with a plan for those needs, and to connect those children and families to available resources in their communities. They can be government programs, they can be community-based organizations, faith-based, informal protection mechanisms, whatever those might be. And then ideally, continue to check in and support and monitor that family. This is a component of social welfare we should have been developing decades ago, back in the big development debates of the 1950s and 1960s. And we focused in, quite understandably, on literacy for education and on primary health care, given the burden of disease. But somehow we just put that to the side. And now we're beginning to recognize the importance that if we're going to have a good, comprehensive, and holistic social policy, the social service workforce and social work are going to have to be at the center of that. And that's an area that the US government, particularly through USAID and PEPFAR, has invested a lot in terms of approaches and tools that work in low resource settings, and that we really could scale up with more resources. Thanks.
Thanks, Philip. And yeah, I feel like this has just been great because I'm a social worker. So I'm all about increasing the social service workforce. So let's see, Jennifer, what is your ideas on what would it take for the federal government community to better address the multifaceted needs of children?
Thank you so much. And thank you, Philip, for really helping to light a fire on how critical this is, so we do not lose the opportunity for young people to fully contribute. So our call to action is, and our opportunity is together to increase funding, coordination, prioritization, tracking, and that true network that's needed for full support for kids around the world. So first, that means making sure that financing and full support is available at all levels, from the local to the national, regional to the global. The US government is doing fantastic work led by USAID, but with really strong engagement across the multiple teams at Peace Corps, the State Department, the Department of Education, Millennium Challenge Corporation. And so now is really the time to increase full funding for that work at the height of the impact of the COVID pandemic and humanitarian crises around the world. And like we've been talking about, really investing in early childhood education and development programs that address the full social, emotional, cognitive needs of children is really vital. For many parents, if early childhood education and support is not being provided, then that has very real economic consequences for them. And so we need to think about that full continuum of childcare. And investing in re-entry programs and outreach and social work and engagement for children and youth who are currently out of school. We've talked a little bit about this, but making sure that there are really student and youth-centered learning approaches and safe schools, and that all learners are safe and healthy and free from violence and discrimination. And Chrissy and others have spoken about the data needs. So this is a real opportunity. Some pilots have been helping to ensure disaggregated data on gender, disability, age, and other factors. But now we must make sure that that disaggregation is fully available across all programs and across all government-funded efforts, because that way we can really make sure that we're actually reaching all children and youth. And at the Global Campaign for Education US, we would love to invite all of you across your communities to get involved. Next week is the Global Action Week for Education. And so everybody's invited. We'll share those links in the chat to join efforts across 100 plus countries underway to really raise young people's voices together. Thank you.
Thanks, Jennifer. I really want to just thank our panelists, and their ideas. I know this is something that is also important to First Focus and the work that we've been doing in trying to raise the visibility of children, right? I think that oftentimes children are not thought of or forgotten in policymaking and some of the decisions. And some of the things, like, for instance, that First Focus is working on with others is child impact statements, which would be that for any policy or programs that there would be an assessment of any positive or negative effects on children that, before the policy or program could be completed. The other aspect, I think, too, and, Chrissy, Philip, Susan, and Jennifer have talked about is just, that this work requires, it requires money and financing and things. And one of the things that First Focus does is the children's budget book. For the past couple of years, we have tracked the foreign assistance funding. And so we would really advocate for better budget tracking. It's difficult to figure out exactly where the money goes or where it comes from. So we have been working with our fellow colleagues in the field in the area and trying to push for that. So with that, the final question before we take questions from the audience is the White House has just announced their second global COVID-19 summit to be held on May 12th. Philip had just, touched on that a little bit, saying that children are not on the agenda, that it's been very, right now the agenda looks focused on vaccine distribution. But I would like to just ask our panelists, what would you want to see at the Summit for Children? And let's start with you, Jennifer.
Great, thank you very much. So it's been mentioned, but this is the time to not just ensure that so-called secondary but resulting impacts of the COVID pandemic are fully front and center, being included in commitments that are being made and immediate implementation. So what does that mean for education and for work that we can do collectively to really support all kids around the world? Let's make sure that commitments, annual as well as new emergency and supplemental funding, fully include those full, complete, holistic impacts to address these needs. We'd like to make sure that health, education, child protection, this vital funding goes hand in hand and is increased together. Thank you very much.
Thanks, Jennifer. Chrissy.
Yeah, thanks, Kathy. I think Philip and Jennifer have really hit on it. And I want to just suggest that, I think in looking toward the summit, I'd really like to see the Biden administration and Congress in turn commit to broad, bold, and transformative action to support children and youth in a comprehensive manner, as Philip mentioned. President Biden did a really nice job of acknowledging the far-reaching secondary consequences of COVID-19 on children and youth specifically during the State of the Union, including mental health impacts. And I think, there is an opportunity amidst the crisis, and that opportunity is really one to mount the kind of ambitious multi-sector response that we've seen with other public health crises like HIV/AIDS. And I would really, really like to see the administration frame the opportunity as what it is and can be, which is one that can dramatically shift outcomes for a generation of children and youth. And as Philip said, I think looking beyond jabs and arms and vaccine equity, which is critical, but really looking at the whole lived experiences of children and what that means for their future and for our collective future. So we know that U.S. leadership in collaboration with national governments, with multilaterals, with civil society, and other humanitarian and development actors around the world can have real impact. And this is the moment for bold ambition and looking beyond partisan politics and the status quo.
Thanks, Chrissy. Philip, I know you had kind of touched on it before, but is there anything that you want to add and what kind of call we can do to the administration for this next summit?
I think they said it beautifully. I would only add, let's remember the lessons from the past epidemics we've experienced. HIV was, like now, very focused in the early stages on trying to address the spread of the disease. Again, quite understandable. But after years, we understood that these secondary impacts were just growing and growing. They may not have been so visible in those first years, but they certainly began to manifest themselves in later years. The whole concept of orphans and vulnerable children came a lot out of that pandemic. The idea of a 10% set aside within PEPFAR for services that are more comprehensive than just health was eventually discussed because there was an understanding later on in that epidemic that we couldn't just focus on the disease. Keeping in mind that children who are subjected to violence and abuse are, according to the evidence we have at our disposal, also at greater risk of being HIV affected. So let's take those lessons learned. Ebola, similarly, there was, I think, a better and more rapid understanding there because of the lessons learned that with the number of children who were losing parents to Ebola quite rapidly, there was a need to come in quite quickly to ensure that they did not end up in forms of care that were harmful to their well-being. And so UNICEF and a lot of other partners moved quite quickly to try to ensure those children were protected early as best they could. That wasn't perfect, those of us who know the story, but I think there was a different mindset to ensure that children received appropriate forms of care as soon as they possibly could because of what we've learned from HIV. So now here we are with COVID-19, and let's try to be smart and be smart early.
Thanks, Philip. I just want to thank so much to our panelists for all your insights and recommendations. I was going to turn it over and see if there's any audience questions, and if there's any comments, please put them in the chat. Or if you're watching it live, you can use the hashtag #KidsAndCovid for questions. And I'll give it just a couple seconds just to make sure that we're not missing anything. But I'm actually not seeing any questions. So I think, our panelists did such a wonderful job that they didn't know what to ask, I guess. But you know what I would like to do is say this. I do want to thank our panelists for joining us today and for leaving us some clear next steps to address the long-term secondary impacts of COVID for children, not only in the United States, but around the world. So as mentioned earlier, this panel is part of a series on the impact of COVID-19 pandemic on children and youth. For more information on our past panels, on such topics as mental health, child poverty, child care, vaccines, children, and immigrant families, or to view a recording of this panel, please visit www.firstfocus.org/KCC, and that'll get you to the links in previous recordings. And First Focus would also like to just thank the encouragement of the Children and Tides Children and Policy Funding Initiative at Tide Center with generous support from the GHR Foundation, Oak Foundation and the Wellspring Philanthropic Fund. So again, I just want to thank our panelists and our speakers. Have a great day to everyone. And actually, just as a final closing note that I wanted to say, because I was so moved, I think, by Susan, and I think she had to unfortunately drop off, but, was talking about the story of Diana in Zambia. President Biden, he has made a comment or has said, that we see you. So I just want to tell Diana and the children of the world, we see you, we're focused on you, and we're going to do everything to help you. So thank you to our panelists, and thanks everyone.
Thank you so much, Kathy.